Good afternoon, everybody, or good morning, depending which part of the world are you following this webinar. And welcome to this UNICEF webinar on the social protection pathway to nutrition based on evidence from Asian Pacific, organized in collaboration with FAO and the socialprotection.org that is hosting the webinar. My name is Andrea Rossi. I'm the Regional Advisor for Social Policy and Economic Analysis at the UNICEF Regional Office for Asian Pacific, and I'm broadcasting from Bangkok. I hope you can hear well. If you have any problem, please use the chat box on the side. Probably every webinar that we are all attending start with the concern of the challenging time that we have facing at the moment for all of us. And I'm sure most of you, like us, has been absorbed by the large number of work related to COVID emergency, particularly if you're working on social protection. We've seen globally social protection as the first, if not the largest bullet used to address the negative impact of pandemic, and more importantly, to the negative impact of all the containment measures that have been implemented. And the socialprotection.org is doing a fantastic job organizing different webinars and discussions specifically related to COVID-19 and providing great tools. So I suggest you keep an eye on the webpage of the site and looking at different events coming up specifically related to COVID. Today, we want to keep a broader vision in the sense that we understand that COVID is changing a lot of things and is also changing a lot of things in social protection. We have seen images of different ways to do registration or payment, etc. But it's important that we continue to work to address problems and issues that already existed, using the knowledge that we develop to find solutions and to those problems. Problems that probably COVID will exacerbate dramatically, but they are not created by COVID. And nutrition, and particularly undernutrition, is probably one of the key ones. With nearly 500 million of the world's undernourished people living in Asia and Pacific, there is that need, an urgent need to address the hunger in all its form in the region. And also we have to be aware that the economic crisis that is probably coming will have a stronger negative impact on children, households, and also on the level of undernutrition. Most of the countries in the world and in the region particularly have developed social protection systems, but the success in fighting poverty that we have seen does not necessarily translate into success in reducing malnutrition. So last year, as a social policy team in UNICEF, we were invited by our nutrition colleagues in UNICEF, FAO, WFP, and WHO to look at the potential of social protection to address nutrition. And thanks to this collaboration, we joined regional nutrition flagship report for 2019 called the Asia and Pacific Regional Overview of Food Security and Nutrition, known as the SOFI report, was dedicated specific to the role of social protection. And I have to say it has been a fantastic opportunity to discuss in depth social protection with nutrition colleagues and share ideas and experiences outside the usual group of social policy and economics colleagues. Now we realize that it also is critical to have the reverse path. So to facilitate a stronger discussion and reflection among social protection experts and practitioners over the links between social protection and nutrition, to look at potential and as well as challenges. So for this reason, we worked together on a working paper. It was linked in the invitation to this webinar to summarize the existing evidence and explore areas of future intervention in Asia and Pacific. And I would say is a kind of follow-up of an original work that we developed in UNICEF with the Innocenti Research Center 5 years ago, where at that time we looked at what we knew and what we didn't know about the linkages between child grant and child nutrition at that time. So to address this one after this introduction, we will have two presentations. The first one is actually based on the working paper, and it will be done by a trio of presenters. Next slide, please. So the first one, the trio is composed by Jessica Blankenship, who is nutrition specialist in UNICEF. Next one. With Ruben Villanueva, who is the social protection consultant still in UNICEF, also at the regional office. Next one. And Jessica Owens, at the social protection consultant FAO. And you have all the description of their bio, so the presentation will be available to everybody. In the second presentation, next one, Nad from the lead social policy advisor from EAPRO will present a very interesting case from the Philippines and the results of the assessment done on the 4 Ps of nutrition. Now, this is a working process. So this is not the launch of a UNICEF publication. This is really part of the process to develop the working paper. So we need comments and contribution to have a strong analysis and to make the paper not only stronger, but more useful to take future decision and action. So to boost the discussion, we invited 2 great discussants. Next one. The first one is Mario from the IPC, next one, and Britta Schumacher, the senior nutritionist from WFP, also here at the regional office. So we think that with their help, we can really have a great discussion and great thinking over the linkages between social protection and nutrition. Next one. We encourage the audience to send questions through the panelist, through the webinar using the chat bar. So you have, this has been okay. Next one. And don't wait till last moment to ask your question, because we have to collect. I will read the question and then put together. So I will see all your question, but the question will be reflected in the chat box. We will make our best to address the questions during the Q&A session, but if not feasible, we will prepare a Q&A written document to be shared with the audience and to be published with the webinar summary later on. And the webinar summary will be available on socialprotection.org some days after the webinar, while the presentation and the recording will be available immediately on the website. And please, when you submit your question, please remember 2 things. Usually, questions are short. We have a very small chat box in our screen, and usually questions end with a question mark. Okay, so please remember that one. But say so. I just want to now ask the 3 presenters to pop up in video so we can see their face live. And I'm saying that one. So next one, let's see, Jessica, Ruben, and Jessica. So I hand over to Jessica B on the first part of the presentation. Thanks so much and enjoy the webinar.
Thank you, Andrea. And so I'll be starting with a little bit of an overview to the nutrition situation in Asia and the Pacific. Next slide. Okay, so despite robust economic growth and substantial advances towards eliminating hunger and malnutrition, the progress in Asia and the Pacific has recently slowed. Next slide. The number of people who are undernourished or who are unable to obtain sufficient dietary energy, calories, to maintain a normal, active, and healthy lifestyle has largely stagnated in Asia and the Pacific from the years of 2015 to 2018. Currently, more than 500 million people are undernourished in the region, with the region accounting for nearly half of all people undernourished worldwide. Next slide. We see similar trends in another indicator for nutrition, household food insecurity. The prevalence of moderate or severe food insecurity has largely stagnated or increased since 2014, with nearly 1 billion people experiencing moderate or severe food insecurity in the region. 327 million people in the region face severe food insecurity, which means that there are households that have run out of food, and at least one household member is now going a whole day without eating. Data reflects the situation from 2018. So shocks such as those due to COVID-19 pandemic can be expected to worsen the situation and shift households along the spectrum of food insecurity, increasing not only food insecurity overall, but the severity of food insecurity. Next slide. That said, poor nutrition is more complex than a lack of enough calories. Next slide. In this region, in the Asian Pacific region, we have a triple burden of malnutrition, with overlapping prevalence of undernutrition, overweight and obesity, and micronutrient deficiencies. When we think of malnutrition, often we think of undernutrition as defined by stunting or chronic undernutrition and wasting or acute undernutrition. There has been steady reduction in the prevalence of stunting in most countries in the region. However, there are still 82 million children, or 60% of the world's stunted children, living in Asia and the Pacific. For wasting, there's been very little change in the past decade. Wasting continues to be a serious public health concern in the region, with 34 million children wasted, which is 3 out of every 4 wasted children in the world. Moving to the other side of the spectrum, The prevalence of overweight and obesity has dramatically increased in the region since 2000. This is largely driven by countries in Southeast Asia, where there has been a 160% increase in the number of overweight children under 5. This amounts to 16 million children under 5 and 115 million children 5 to 19 years of age who are overweight or obese in the region. Last but not least, micronutrient deficiencies, or hidden hunger, are highly prevalent in the region, with 158 million children experiencing at least one deficiency. While often overlooked, vitamins and minerals are essential for growth and development, with deficiencies having serious impact on children's current and future health, wellness, and economic attainment. It should be noted that the 3 states of malnutrition do not exist in a vacuum from each other, but exist together in the same countries, households, and even in the same person. A household can have an overweight mother and a stunted or wasted child, and a child can be stunted, overweight, and anemic at the same time. In fact, stunted children are more likely to become overweight, and micronutrient deficiencies can contribute to child stunting. It is notable that every country in Asia and Pacific has an overlapping burden of malnutrition, and that food insecurity contributes to all 3 states, with increasing prevalence of overweight and obesity amongst even the poorest households. This is largely due to inexpensive, highly processed foods, easily available, affordable, and convenient. Next slide. Just as the problem of malnutrition is more complex than just a lack of enough calories, addressing the triple burden of malnutrition requires more than just having access to enough food. Next slide. I'm going to briefly introduce the UNICEF conceptual framework of the determinants of maternal and child nutrition. This is used as a basis for understanding the enabling, underlying, and immediate determinants of maternal and child nutrition, and the pathways through which social protection can improve nutrition. This framework is equally applicable to all members of the household, not just to women and to children. The provision of cash transfers with nutrition-focused SBCC, or Cash Plus, improves nutrition through 4 main pathways, which address the 4 main drivers of improved nutrition. Next slide. Cash transfers can raise overall availability and affordability of adequate, nutrient-rich foods. As we said before, it's not enough to provide access to a diet with sufficient calories, but to a high-quality diet containing essential nutrients to prevent micronutrient deficiencies, overweight, and obesity, as well as undernutrition. Next slide. Cash transfers and nutrition-focused SBCC can also improve adequate feeding through improved knowledge on feeding practices and food preparation. Without well-linked nutrition-focused SBCC, access to adequate foods alone cannot be expected to change practices and behaviors. Next slide. Cash transfers and SBCC also increase access to a healthy environment through increased availability and use of health, water, and sanitation services, preventing disease and enabling people to fully utilize and absorb the nutrients they eat. Next slide. During times of financial stress, however, shock-responsive Cash Plus programming can prevent the deterioration of dietary quality and nutrition status and maintain access to high-quality foods, services, and good practices. Next slide. Lastly, cash transfers and nutrition-focused SBCC contribute to creation of positive norms and sufficient resources by empowering women through improved knowledge, increased social capital, and ownership of resources to address the enabling determinants of improved nutrition. Next slide. As the triple burden of malnutrition is multifaceted, to address this challenge, we need a multi-stakeholder approach. Next slide. To address this, in the East Asia and Pacific region, regional nutrition partners came together to determine the priority actions required to address the determinants of improved nutrition. These actions, identified in the Nutrition Framework for Action, are implemented through a systems approach to nutrition, obtaining improved diets through the mutual engagement of 5 systems: education, social protection, health and nutrition, water, sanitation and hygiene, and food systems. All priority actions recommended are implemented through these systems and through changing both norms and behaviors to implement practices. The improvement of nutrition status through cash transfers and nutrition-focused SBCC should be linked to these priority actions to maximize their impact. Next slide. For example, to address the first determinant of high quality and consistently available, accessible, and affordable food, cash transfers can raise overall availability and affordability of adequate nutrient-rich foods when implemented in conjunction with priority actions through the food system. And some of these actions, as identified by the regional group, include incentivizing the production of diversified crops, nutritious complementary foods, and to address overweight and obesity as well, restrict the marketing of unhealthy foods to children, and to improve labeling to allow consumers to make better choices. Next slide. While cash transfers and SBCC increase access to a healthy environment through increased availability and use of health, water, and sanitation services, it's essential to strengthen both health and nutrition and water, sanitation, and hygiene systems to ensure that services are provided routinely with high quality. The identified priority actions for the region include strengthening financing and capacity for the sustainable delivery of quality nutrition services and strengthening environmental hygiene within wash services with a focus on baby wash. Next slide. The third determinant is directly focused on social protection to ensure families have sufficient money and knowledge to access and provide a healthy diet in their household. Priority actions include targeting social protection programs to the first 1,000 days from pregnancy to 2 years of age. These would be through maternal child cash transfers. These programs should be strongly linked to innovative mass communication strategies, including the use of social media to build sustainable national capacity for SBCC. The recommendation is not for a one-off SBC strategy targeted to social protection, but to a fully integrated strategy implemented across the 5 systems. Next slide. During times of financial stress, priority actions to improve nutrition focus on social protection, but we require strong and reliant education, food, water, sanitation, hygiene, and health and nutrition systems to be in place and supported. Priority actions include targeted social protection programs for the first 1,000 days and ensuring linkages to a well-functioning SBC strategy. In addition, during times of financial stress, there may be a need for social protection programs to directly link with health and nutrition systems to increase coverage and finance for essential nutrition interventions, including fortified complementary foods and multi-micronutrient powders, to ensure that the vulnerable populations receive essential nutrients they require to thrive. The priority actions I've presented need to be implemented in unison and not in silos. It is the combined impact of priority actions to the 5 systems together that can significantly improve diets and reduce malnutrition with social protection an essential component. I'd now like to hand off to my colleague Ruben and Jessica to continue the presentation.
Thank you very much, Jessica. Next slide, please. Well, thank you very much for your thorough explanation from the nutrition side. Let me jump now to the other side of the bridge, to the social protection one. And I would like to walk you through the next slides through the why, the what, and the how. Jessica already touched a little bit on that, and my other colleague, Jessica Owens, will touch on what has been done in the how. So the why, I think, can we jump the slide? That one. So how first, social protection is usually referred to as a means for reducing inequality and poverty, and that's one of the main objectives of the system, right? But it serves to many other objectives, and to be honest, it serves to almost all SDGs. So it tackles poverty and inequality, is goal 1 and 10, as I was saying, but then it also strengthens food security, goal 2, better health and cognitive development, goals 3 and 9, strengthens education outcomes, goal 4, promote gender equality, goal 5, strengthens social inclusion and cohesion, goals 11 and 16, inclusive growth, decent work, and more productive employment, goal 8, this is the contributory side of it, and improve macroeconomic resilience, goal 12. And lastly, and most importantly, the reason why we are here today is because social protection fosters development partnerships, goal 17, and that's why the importance of working multisectorally and across stakeholders, as we are doing today here, right? So from the nutrition sensitive perspective, as Jessica was explaining, it can contribute to address some of the economic and social determinants of malnutrition, in specific the enabling and underlying determinants. But the potential of social protection for nutrition outcomes basically comes from the suitability of the platform based on its coverage and the possibility of scaling up those, as we are seeing in the COVID-19 and other I mean, it's like it can be scaled out quite rapidly and target and reach out populations that otherwise could take longer to reach. So that's the main added value of social protection for nutrition outcomes. Next slide, please. And then following with the what does the evidence from Asia and the Pacific tell? Basically, the complexities around the prevention and management of all forms of malnutrition, reference based to the triple burden that Jessica was presenting, often lead to social protection practitioners, which I think basically in this forum they are pretty much either nutritionists or social protection practitioners, overlook its causes and potential solutions within our own programs. Well, while evidence about the impact of social transfers and in other areas such as education enrollment rates or poverty alleviation and inequality is well documented, its impact on malnutrition is still mixed and scant, and that Jessica will show in our working paper that it's been improving, but still keeps being not enough. However, thanks to a new generation of nutrition-sensitive initiatives, that's what we have been trying to stocktake, particularly since the launch of the 2013 Lancet series on maternal and child nutrition and the Global Forum on Nutrition-Sensitive Social Protection, which took place in Moscow in September 2015. These two fields, social protection and nutrition, have been leveraging existing synergies and pursued opportunities for an enhanced impact on nutrition. This is an example of that. So new thinking and accumulating evidence ever since have helped to define the key principles that should guide the social protection programming for nutrition outcomes. Many guidance documents have been produced since the 2015 stock taking, the global one that Tanera was referring at, and until today. So we have come a long way since the first guidance and the theory of changes. So a lot of improvement has been done in both design and evidence stock taking, but there is still a long way to go. Next slide, please. So what is going on in Asia Pacific, specifically talking about social protection? When we have a few caveats in terms of data, evidence base and evaluations. In terms of evaluation, social protection programs, the region is still lagging behind other regions of the world. So the evidence base for social protection is very thin still in this region. That's a starting point which doesn't have too much when you are looking into nutrition outcomes as well. In addition, programs being evaluated and which include in their theory of change nutrition outcomes are usually in a pilot stage rather than well-established national social protection programs. There are a few, you can count with a finger of your hands, big national-wide social protection programs being evaluated rigorously and continuously. As you will see later, this has a direct impact on the evidence for this region. Next slide, please. Even though those limitations, this is the evidence we have from this region, it gives us an opportunity to keep improving and taking lessons from there. So even though there's a regional variation in social protection terms, the general trend in Asia and Pacific is positive, with several countries throughout the region having created new schemes in the last years or significantly increasing their coverage. That's a good starting point. But despite this momentum, large coverage gaps remain in the areas of child and family benefits, maternity and parental protection, and unemployment protection. Let me give you some hints on the state of social protection. Only 38.9% of the whole Asia Pacific population is covered by at least one social transfer. One of the region's most notable characteristics as well is the wide variation between countries. The maturity of the social protection systems varies a lot between countries. For example, we have East Asian Pacific, South Asia, sub-regions where coverage and adequacy of benefits change so much. Let me give you an example. 40% of East Asian Pacific population compared to only 24% in South Asia receive no social protection benefit. But in contrast, East Asian Pacific nations achieve better benefit adequacy as compared to South Asian nations, where the adequacy of benefits is worse and the benefits are lower but the coverage is higher. So there is this contradictory that as a platform to deliver other services, it comes with the bottlenecks and limitations. Next slide, please. Before then, all this lack of expenditure on social protection, and when it comes to child and family benefits specifically, all that affects, of course, the income security of families and their children and their nutritional status. So that's a big limitation and the starting point that we need to consider. Another interesting point in this region is is that basically cash benefits play a big role, but not the only role. You have big in-kind safety nets still, especially in South Asia, school meals programs, rice subsidy, rice distribution, and then you have provisional services as well, like childcare, which in some countries play a dominant role. So cash transfers are not that big in terms of within the social protection space. Next slide, please. So I would like to finalize before going into the paper itself. Is a snapshot of the working paper. So we have included 16 evaluations from 9 different countries, and we do recognize that there are many more that we might have left out. We have approached this as a practitioners, not as a researchers. These are stock taking of the most relevant evaluations and programs that we have found. Some coming to my mind now that we may have left outside is the Cook Island. They just commissioned a cash transfer evaluation, qualitative one. That's another issue, qualitative versus quantitative, that we will touch upon later. Another randomized control trial in Bangladesh, commissioned by IPC and OFP a few years ago. But so please feel free to suggest in the box chat any information, evaluation that you may think it's important. And again, we have tried to focus on nationwide government-led social protection schemes and the evaluations that come with those schemes. As I was saying, because there are many pilots and NGO-driven or externally driven, that's a big limitation in terms of the evidence basis that we are having. However, we have included some of them that resulted in a national government-led scheme, like the Nourish program in Cambodia, led by Save the Children, because we consider those as a good lesson learned and as a good practice, and national programs could learn from those. So without any delay, I would pass the word to my colleague, Jessica Owens.
Okay, thank you very much. Next slide, please. So I will now turn to the evidence, what we have found in the review that we have done across the 9 different countries and the different programs that we found. And the evidence is organized by the conceptual framework. We try to stick with the conceptual framework. So we will first look at the evidence on underlying determinants, then we will look at the immediate determinants, and then we will look at the nutrition outcomes. So quickly to go through it, because there is, even though there's not as much evaluations as we had hoped for, there is still quite a lot to put in. So what we find is that for food security, there is mixed evidence. We see that some cash transfers and public work programs have been able to increase expenditure on food as well as on caloric intake, such as in the Philippines and in Bangladesh. However, other evaluations reported that the programs have failed to achieve sufficient consumption, especially in children, such as in Indonesia and Nepal. So just to say that so some of the possible explanations that have been given by the researchers that have conducted this research have shown that it might be due to the low transfer size, and this we see that in many cash transfer programs still the transfer size is quite low. For example, for the Nepal program that was evaluated, the recommendation was to maximize the nutrition outcomes, you would need to have the cash transfer at least 20% or more of the household consumption. So important to keep in mind that this transfer size is an issue that is covering many of the cash transfer programs in the region. Another issue that came up was the inability to keep up with inflation, for example. This was in Indonesia. Even if the program tried to keep up with inflation, it was difficult to keep up, and this reflected possibly in these types of outcomes. The second area of underlying determinants is this access to health services. We know that there are different barriers to access, such as the cost of transportation, as well as the cost of services themselves. We know that there is limitations in, although governments have been trying to expand coverage of social health insurance, that still a lot of the expenses are being borne by the households, out-of-pocket expenses. So we've looked at also to look within these evaluations what we could find, and we see that there is an improved access to health services, especially for children. This is a bit more mixed for women. So for children, we do see that there has been increase in average per capita expenditure on medical services, increased health-seeking behavior for children. This also depends a little bit on the type of services that is provided, where we see, for example, in the Philippines that for certain services such as vitamin A administration or growth monitoring, this has been quite strong results, while immunization of children had less strong results. So there are sort of areas that still need to be looked into to understand why these different results. For women, it is important to note that prenatal care in the evaluations that we have seen, especially for Indonesia and the Philippines, have positive results, so greater health-seeking behavior for prenatal care. However, for postnatal care and professional-assisted deliveries, this is they have not shown any results improvements. So what the potential sort of researchers have pointed to possible explanations for this also. First, the meeting the conditionalities. Several of these programs, such as in Indonesia and in the Philippines, are conditional cash transfers and have certain conditions that you have to abide for. They also have messaging. So the question is whether this messaging is also being equally applied for both the pre and postnatal, whether the emphasis on women's health care and combating the cultural norms is also being equally included in the messages. It's also another issue which is important to sort of point out that may play a role is the supply side. We've seen that in some of the evaluations, the concern is these conditionalities often bring a higher demand for these types of services. So, but the services need to keep up with the ability to be able to provide these services to this increased demand. One of the examples that was interesting that we found is in India, where they provided an incentive for the service provider for each delivery in a health center, and this incentive was higher in rural areas than in urban areas, and this also was seen or reported in the outcomes where there was more households, women delivering in health centers. Next slide, please. So also we, as Jessica also mentioned, it is important to also look at the wash or the hygiene practices that are in the households. Here the issue is that we have only found very limited evaluations that actually report on wash indicators. So what we have found is one evaluation, Nepal study, that has shown that households shown positive hygiene practices, improved hygiene practices within the households. One other evaluation that has shown from the Myanmar that has shown that there wasn't any effect on hygiene practices. And then there was a third evaluation, a midline evaluation that was for Cambodia, which showed that they didn't include a component on wash, which was the including vouchers for latrines, and this translated in increased expenditure on latrines. But just to keep in mind that we only have a few examples of the impacts on WASH. So it might be because the interventions just do not include this within the theory of change, so they're not monitoring and reporting on this. Another area that is very important, and this goes between the underlying determinants and the enabling environment, is gender equality and women's empowerment. And this is important because we see that it influences the intra-household dynamics and the decision making and access to resources. So this is, we wanted to also see if there were any evaluations that were able to report on these measures or proxies to gender empowerment. And here we also found that the evaluations showed no effect on women's decision-making power or mobility, and rather the contrary. What we see is that the pre-existing norms where the husband and the in-laws take most of the decisions and make the decisions on how to spend the transfer that is provided to the woman. So important to keep in mind. The next area is the practices, the care and feeding practices that are crucial in looking for positive outcomes in nutrition. And here we also see some mixed results. We do see that positive results in terms of early initiation of breastfeeding, such as in Bangladesh or in Thailand also, and the introduction of solid foods after 6 months. However, in the Philippines, these results are a bit more mixed. So there are positive results, but still mixed. An important factor to highlight in these programs is the BCC, and this is something that already Jessica mentioned, the nutrition education or behavior change communication that was included in these programs that were attributed for the positive impacts in taking up these good practices. And for example, in one of the Bangladesh's evaluation, it showed that not only did it have a positive impact on the participants of the program, but also on the community, wider community, so the spillover effects. Next slide, please. So we now turn to the immediate determinants, and just a reminder, this is the good health status and healthy diets. And here also we find mixed evidence. So we have seen that there is with a reduction in infant mortality with the increased coverage of social protection more generally. However, when we look at programs, here also we have seen very limited amount of reporting on child health status. We found for programs such as in India that even though they provided incentives and they encouraged women to use obstetric services, they only reported very modest reduction in perinatal and neonatal mortality. And here comes again this idea that the quality of the supply of this provision is important and may play a role in these types of results. Looking at healthy diets, here there's more promising results. We see that there is, from several programs, an increase in intake of healthy foods, especially protein and vegetables. There are differences that we notice, such as in the Philippines, where in rural areas the protein intake is higher than in urban areas. So there is still need to understand better what are the factors influencing these differences. And also we see that there is an impact, for example, from the Myanmar program on the increase, the improvement in minimum diet diversity scores for both women and for children. So it is the positive. On the other side, we also see that in Indonesia, only 40% of the children were meeting the minimum requirements, diet requirements. So we see that it is a mix. They are moving towards healthier foods, such as protein and vegetables, but still there is an issue in meeting the minimum needs. Here, some of the possible suggested reasons for this is, again, the affordability of these different types of foods. So we know that staple foods are often cheaper than more high-value foods such as protein or vegetables, etc. And so this might play a role in accessing these. The same thing is in inadequate benefit levels. So trying to understand what is the competing priorities in households and whether they are able to meet their food intake needs. Next slide, please. So now we're going to turn to, thank you. The nutrition outcomes, looking at anthropometric measures, as Jessica had explained. So here we also find mixed evidence, but what we do see is an increasing of number of programs that show improvements in stunting, wasting, and underweight of children. The interesting fact here is that many of these programs, what they show is that the importance of a more comprehensive approach or integrated approaches, which includes social behavior change communication, which includes maternal and child health interventions, which includes agriculture and livelihood programs, and putting them together, and that have contributed to these positive outcomes. There are, of course, more mixed results from Indonesia and Philippines that have several different types of evaluation reports. And some of these results even contradict each other, where we see sometimes that there have been negative impacts on stunting, for example. Here there is need to understand better what is happening in the program and how to explain it. Some potential areas to look into is the duration of the programs. Also, the effect of the increased demand from the messaging of certain foods and that effect on the prices of these quality foods. So the inability for the local supply to meet the demand and increasing prices, as well as the fact that many of the programs may miss the opportunity that is needed, which is that critical area in the 1,000 days that is critical to support especially these anthropometric measures, as well as thinking of a more life cycle approach and thinking of how the different how the effects of malnutrition adolescent women will have impacts in later on life and in childbearing age. Finally, just to say that we have also found 2 studies that have reported reductions on micronutrient deficiencies, and this is quite important. One has reported on the proportion of women with anemia has decreased, which is in India and Bangladesh, and non-zinc deficiency. Just to put a bit more context, in India, this was a question of a cash transfer pilot, and in Bangladesh, it was the VGD program that provided the fortified rice to households. One of the reasons maybe we do not see this so many reporting on micronutrient deficiencies may be the lack of monitoring or the more difficulty in measuring these micronutrient deficiencies. Next slide, please. So this slide is just a summary quickly to put a little bit of what we've already gone through to show that there are few evaluations to call upon when there is quite a few programs that have been that are existing in the region. A lot of it is mixed results, and I think the most important message of this slide is really that we need to understand better the impact pathways, understanding, and this will have implications on how we design our programs so that we really do see the results that we want. Next slide, please. So what does this all add up to? So just going a little bit now towards back to, we see what are the findings. We see that there's still a lot of uncertainties, understanding of what is playing which role and what factors to be considered. What we do see also is that design matters, so that design and implementation of social protection programs matter if we are to achieve positive food security and nutrition outcomes, as well as for more wider human development outcomes, which are still not always being achieved. A few areas that I just wanted to just highlight is, again, the size of the transfer. The size of the transfer is something that seems to be an important factor. It is important to include the cost of nutritious diets, but we also have to take into consideration that households, especially poor households with very, very limited income, have multiple competing priorities on this income, and they have even additional competing priorities as social protection programs come with many messages. This includes education, health, nutrition, and just the normal livelihoods, trying to make a livelihood. So this is an important factor. We know that in rural households, the consumption and production decisions, for example, are heavily intertwined. So there is this need to really understand better the decision-making processes of these poor households. Gender, this is one area that I think is very important and that is not being captured within the programs at the moment. Intra-household dynamics, it needs to be considered when designing these programs, understanding what are these intra-household dynamics, understanding where the cultural beliefs and norms that are shaping these dynamics, and what interventions can really empower the women, and moving beyond the idea that the transfer to the woman will empower the woman. And the third area is this, linked to this is the cultural and knowledge practices and the importance of this social behavior communication change, but also understanding that in many of the programs that we have seen it yet, which have had a very important impact because of the behavior change communication, it's still, they have been very much funded from donors, and we're trying to see what works in this behavior communication, how can this be integrated into national programs, who is going to be providing this behavior communication, and going ahead. The last message to leave you with is the need for comprehensive approaches, and I think this comes out from the whole series of evidence that to be able to really tackle the complex challenge of malnutrition, we do need to bring on board the different sectors, including social protection, education, agriculture, WASH, and etc. And I leave the last slide to my colleague Ruben. Thank you.
Thank you, Jessica. Next slide. Very, very quickly, just to summarize what we found. So basically, Asia-Pacific region provides a rich opportunity to expand social protection, nutrition-sensitive impacts. There is a base, there are programs out there and can be improved. They are showing results. The evidence from the region is still exceptional and hard to come by in comparison with other regions. Another bottleneck in there. Lack of robust impact assessment of cash transfer programs. That's a generalized problem in the region. One thing we detected that there is a lack of harmonized regional research frameworks that would allow detecting regional patterns and trends, as we have seen in other regions, like in Africa, a transfer project where you could put together different databases and look for patterns. Finally, the importance of government-led evaluation in the region is basic and is one of the difference between this region where programs are government-led, public funded in comparison with other regions. And finally, the improved evidence building can expand these development impacts in the future. Over to you, Andrea.
Thank you so much, Jessica, Ruben, and Jessica. It was a fascinating presentation, really. I really appreciate the time and the content, really. Now we would like to hear more from Nad from EAPRO, a specific case from the Philippines. So I will ask, Nad to come in. Over to you, Nad.
Perfect. Thank you very much, Andrea. So without further ado, let's look at the rapid qualitative assessment that we did in the Philippines. Stunting and wasting of children remains a major public health challenge, health problem in the Philippines, and questions around the importance of the conditional cash transfer program, the 4 Ps, in terms of the impact on beneficiaries' nutrition status arose a while ago, and really have been floating around for quite a while. Next slide. On the next slide, you will see some information about the program. The 4Ps is the Philippines' largest social protection program and also one of the largest in the world. It provides cash transfers to over 4.4 million households, conditional on meeting certain education and certain health conditions. In addition, households have to attend what they call in the Philippines family development sessions, where they get taught information on a range of subjects, anything from violence against children to nutrition as well. On the next slide, you will see the scope of the study. To better understand the impact and the potential of the program in addressing nutrition challenges. Oh, sorry, can I have the next slide, please? Yes, excellent. To better understand the impact of the program and also the potential of the program in addressing nutrition challenges in the Philippines, UNICEF and the Philippine government's Department of Social Welfare and Development asked us, EAPRO, to conduct a rapid qualitative assessment of the impact of the 4Ps on nutrition outcomes. The assessment explored in how far the 4Ps has impacted the underlying causes of malnutrition at, first of all, the household level, so in terms of food security, healthcare, and care practices, and in how far these outcomes at the household level were translated subsequently also in outcomes at the child level, in terms of the child's dietary intake, as well as their overall health. In the assessment, we looked at the circumstances also under which the program has achieved impacts, and also what main barriers to achieving impacts currently exist. And we went to 6 municipalities across the country, both several municipalities with above average nutritional outcomes and several municipalities with below average nutritional outcomes. And ultimately, we conducted key informant interviews, focus group discussions, and a range of in-depth interviews as well. So on the next slide, what we found largely confirms some of the views and findings earlier presented today. To start, the assessment found that the cash transfers had positively impacted the food security of most beneficiary households. And we saw that the quantity and the quality of food consumed within the household also improved. Within this, beneficiaries mentioned that the family development sessions are a real reason for the improved variety in their meals, as they learned to prepare different, more nutritious meals. However, when it comes to food security, we see a clear distinction. And that distinction is between households that have complementary income besides the 4Ps and those who do not. And we also see a difference between bigger households and smaller households. For households that have complementary income, we see that households report a better ability to buy more food, and also very importantly, to spread consumption of food better throughout the month and actually also throughout the year, spanning the lean season. This only though for those areas where payments are regular and also predictable. And that is where sometimes, especially in rural communities, there are real challenges. This, where it is not the case, this is substantially lower. Food is also more diverse for these households, though there is room for improvements in preparation methods, as households resort often, unfortunately too often, to unnutritious methods such as frying. When households do not have complementary income, and when they are bigger, these impacts are less prevalent, and more beneficiaries in all our interactions with them report to go hungry at the end of the day, especially during the lean season, and even more so where payments are irregular, again, primarily and predominantly in rural communities. On the next slide, we move towards healthcare. So with regards to the uptake of healthcare services, the 4Ps cash transfers had positive impacts as well, as it helped 4Ps households to cover health-related costs, such as the transportation to the health facility and the costs of medicine that are unavailable in those facilities. The impact of this healthcare seeking behavior, meanwhile, as we could also heard from the previous presenters, is lowered by supply side conditions. And beneficiaries report, for instance, shortages of free medication or other out-of-pocket healthcare costs. And with that, they need to divert some of the 4Ps money away from some of the other expenditure categories would these free medication shortages not have been there. Meanwhile, what we also see is that the family development sessions were shown to really have influenced how caregivers go about their personal hygiene and also hygiene practices in general. And perhaps surprisingly, and more on that in a bit later, we heard a lot of beneficiaries mention that they use some of the 4Ps money to improve their sanitation facilities. Okay, on the next slide, we move to care practices. The 4 Ps also seems to have a minor impact on care practices of caregivers, as the 4 Ps cash transfer really helps to reduce financial stress within the household, in turn affecting caregivers' well-being and the care practices towards their children. Important to note again is that we saw this much more prevalent in households where we had complementary income versus households where no such income existed and similar financial stress levels prevailed. Within this, the family development sessions were also mentioned as an information source for care practices. These sessions, moreover, had important empowerment effect as they strengthened the bonds between young parents. And caregivers also mentioned that they feel more empowered in intra-household negotiations about resources, for instance. As a result, we really get the feeling that caregivers feel much more connected. They feel better informed, they feel more resilient, and they also feel less isolated. So on the next slide, we ask ourselves the question, how does this translate into the immediate causes of malnutrition? With regards to the immediate cause of malnutrition at the child level, the assessment found, similar to what we reported on by the previous presenters, that the dietary intake of most 4 Ps beneficiary children has likely changed with the availability of more cash in the household. When it comes to health, it's a bit more mixed. Most caregivers did assess their children as healthier than in absence of the program, and caregivers also at the same time seems to be aware of the effects of their own health and their own hygiene practices on their children's health. However, important to note here is that these are largely self-reported impacts. Okay, so what can we conclude on the next slide? What factors promote nutrition impacts? To start, overall, we see that cash is vital and that the 4 Ps cash transfer has strengthened the food security of many beneficiary households. The transfer constitutes a more or less regular form of household income, which allows households to plan their food expenditure also accordingly, of course. In addition, we see that complementarity is also really critical to ensuring that the cash also translates effectively into outcomes. Within the 4 Ps, this is seen in the family development sessions, which have played a major role in empowering caregivers. By providing caregivers with knowledge on a range of topics, they felt more empowered and they felt better equipped to, first of all, handle their children, but also overall learn to be more confident in their interactions with their children and other household members. Ultimately, we think that these empowerment impacts strengthen outcomes across all the impact trajectories. And finally, the 4 Ps can, and partially actually already has, functioned as a platform to connect beneficiaries with other existing complementary initiatives. And this has had important impacts already, we think. As for example, the positive impacts on spending on sanitation facilities is likely a result of the program's linkage in some communities where we went to a free toilet bowl initiative set up in parts of the country where we heard these impacts. Good. On the next slide, we at the same time also see that the assessment found the range of factors currently hampering the achievement of impacts. First and foremost, the cash benefit level has not been adjusted to inflation since program rollout already, and hence its real value has decreased substantially over time. With increasing food prices, beneficiary households cannot purchase the same amount of food as they used to before with that amount. Likewise, the limitation of the education grant to a maximum of 3 beneficiary children per household has limited what we think the cash transfer's potential to enhance food security in larger households. Furthermore, we also see that the irregularity and the infrequency of payment in some locations really constitutes a barrier for the cash transfer to achieve more profound impacts. Not knowing when next payments come reduces beneficiaries' ability to plan their food purchases. Really important barrier towards achieving impacts. Thirdly, we also found that the program is not successful in targeting the youngest children today, and enrolled children, on average, surprisingly, are much older than excluded children. This is a result of the program's reliance on a relatively old targeting registry with data from 2009. Whilst enrolled children started receiving when they were young, the inability to re-register new young families and younger children has led to a generation of children being excluded from the 4Ps program. And of course, we all know that this is problematic, as all those children are missed with regards to the monitoring of the health and education conditions, and also miss the, most importantly, associated benefits. And finally, over here, the transmission of knowledge and information to beneficiaries to induce behavioral change, it could be optimized further. A challenge to more effectively transfer knowledge and induce permanent change today seems to be the format in which the family development sessions are currently being delivered. We see that the spaces are often crowded, it's often loud and noisy, and presenters do not make use of the microphones or any visual aids that they have at their disposal. Furthermore, we also see that the models on health and nutrition are still a bit short, and they do not provide detailed enough information. Okay, on the next and last slide, based on the above, we put forward several recommendations. First, with the objective to enhance existing components, and second, with the objective to foster integration. So the first recommendation is to periodically retarget the 4Ps to, of course, ensure that vulnerable children and households are covered. Second, we also recommend to index the benefit level to inflation to secure the real value of the transfer. Third, regular and more frequent payout schedules should be set up and guaranteed, especially in those communities where these payments are not guaranteed or regular these days. And fourth, the study also recommends to strengthen the delivery of the family development sessions by improving, first of all, the infrastructure, and second of all, also reviewing the methods and the guides for delivery. In addition to these improvements to existing components and sort of building on the fact that we found complementarity to have such significant impacts, we also suggest to strengthen integration. As we've heard, nutrition is a complex outcome requiring more work than just cash inputs. We recommend to formalize linkages between the 4Ps and other initiatives because, and especially in the realm of livelihoods, because cash is still very important. A key, very vulnerable group not achieving the level of impacts that we, of course, want them to achieve are those lacking supplementary income. Helping these families build livelihoods and engage in income-generating activities thus not only strengthens return on investments into these livelihood programs, but also the return on investments to the 4Ps program. A really smart investment to make. But the good news is that the government is already working on implementing some of these recommendations. They understand that overall the 4Ps has all the potential, that following a series of successful alterations to program design and implementation, that it has potential to achieve positive impacts on nutrition. Almost all parameters are there. Many things are already going well, but now it is up to the government to take the next step and really promote this program from a passive contributor to nutritional improvement to a key element in the country's fight against malnutrition. Thank you very much. Over to you, Andrea.
Thank you so much. Hope you can hear me. Yes. Thank you very much. I think it was a fantastic presentation and also a great move into the how. So how we do things, how we can change the design. And thanks also, we are monitoring all the questions that are coming in. Please keep sending to us. Try also to be as specific as possible if you can in your comments, and a couple of clarification. Make sure that we are not talking about paying people to giving money to implement our programs. Always remember that the basic of social protection is that the cash allow people to set their own priority. So it's the household that decide what is their priority among the multiple priorities they can have, multiple problems and issues, of which nutrition is one of them. But always keep that in mind. But to start the discussion, I would like to have the two discussants. So Britta and Mario are on welcome. So also Mario, if you can come in, and while we are waiting for Mario, great. Please, let's start the discussion with a question and a comment from each of you. Britta, over to you.
Okay, thank you very much. Thank you very much to the presenters for this very rich sharing of the and summary of the report. I think overall this paper or this report is a very welcome resource for us as we are trying with a large dimension of malnutrition in Asia and Pacific to explore other sectors and other pathways to maximize acceleration of progress towards the national nutrition goals. It's a great continuation of the work we've done last year together on the SOFI, and we hope that the discussion here will really stimulate further thinking. What I particularly like about the document as it is right now is the structure. The structure really permits the reader to look into what social protection programs can do for other than poverty-related outcomes. Like if I want to know something about how social protection program can contribute to food security, then the structure permits me to immediately find that information. Same for improving diets, feeding practices, and health. So having said that, I also have a question and for the panel. And so we have heard in summary, while there is some evidence, some clear and some mixed evidence available on how social protection programs can have an impact on nutrition and diets. Overall, the impression that is given that we don't have enough evidence, especially in view of the large-scale social protection programs we have in the region. So let me ask you then, what are the barriers to having more evidence available in the region of the impact on nutrition and diets? And or what does it take to actually to increase this evidence? Because this is not very clear. So how do we take this forward? How can governments take this forward? What is it that hinders us or the governments or the national players to generate more evidence? Over.
Very good. That was a very good question. Thank you, Britta. And Mario, over to you.
Yeah, thanks. Also from my side, thanks a lot for these incredibly informative presentations. I found it really nice to see that nutrition experts and social protection experts are discussing together in this webinar. And I think this is what is actually needed also to address such a complex issue as malnutrition, and to really help to improve the diets and the nutrition practices among the poor and the most vulnerable parts of the population. And my contribution and my question also try to make a little bit of the link between the first part of the presentation that focused more on nutrition and the second part that focused on social protection. And I remember one really impressive slide in Jessica Blankenship's part of the presentation that said the problem is more complex than a lack of calories. And then she also introduced this concept of the triple burden of malnutrition that consists of undernutrition first, then second micronutrient deficiencies, and third overweight and obesity. And especially the last, overweight and obesity, is growing also in the Asia Pacific region, as we saw in the presentation. Then in Jessica Owens and Ruben's presentation on the review of the evidence, we saw that many evaluations showed positive results regarding food consumption, food expenditure, food intake, and also an improvement in anthropometric measures like stunting and wasting. Also a little bit of evidence for an increase in dietary diversity, but not so much on the second and third component of this triple burden of malnutrition, which are the micronutrient deficiencies and overweight and obesity. And now, that could basically be there could be two reasons for this. One is that policy doesn't consider the triple burden of malnutrition yet adequately, or is it just research that hasn't picked up this triple burden of malnutrition adequately? So my question to the panelists is, to what extent are social protection programs in the Asia and Pacific region already addressing the triple burden of malnutrition? And also, how could social protection programs in the region be adapted in the future in order to more effectively address these three dimensions of the double burden, of the triple burden of malnutrition? Thanks.
Thank you. We would like to ask, maybe Ruben start with the first question. Over to you.
Yes, thank you very much. Yeah, I will take the first one from Britta. And based on our experience, is a good question, because I think we have to differentiate. In Asia Pacific is a very big region, right? So I think we have to differentiate two different approaches and models in terms of public policy. So social protection, especially in East Asian Pacific, where we see that is a public funded social policy, and is government led, government funded, mostly, not everywhere, and that is linked to the type of research it follows that type of programs. While in South Asia, perhaps the type of fiscal space is lower in some countries, and the type of social policies implemented are different, are donor driven, are donor funded. So you can see a difference on the type of programs being evaluated. So drawing from East Asian Pacific now, in this case, which is a lesson we have learned, is from Thailand, is the government-led programs need government-led evaluations, and we have seen that, for example, in Thailand. It's a super program. UNICEF supported the government to put together along with EAPRO, was involved an evaluation and showed some results, but then we realized, okay, but it's not enough. The time frame, it wasn't enough to really see impacts on nutrition, and the program was starting at that point, right? So now the program is stable, is consolidated, is integrated in the government's budget. So what government decided for the future is, okay, we will consider this evaluation as a first evaluation, right? And then we will build on top of that next waves of evaluations. And we expect to see on those children from 0 to 2 that now are covered until 0 to 6 to see somehow an impact on nutrition over the time. And it's going to be driven by government, funded by government, and of course. So that's an interesting model for the future, where you can integrate other research tools in that. And this is reflecting actually what is already happening in the Philippines. That's why the 4 Ps is the most researched, social sustenance, social program, protection program, because they already have 3 waves, 0 wave. And even though it was donor supported, still today is donor supported, but it was originally even more supported before. But the way they build the program is what gives the 4 Ps that added value in terms of nutrition outcomes and other outcomes. So I think those 2 examples are a good lesson for other countries to follow. Over to you.
Thank you. And even if the triple burden was not part of the paper, but it was a very good point from Jessica, is anybody who wants to answer the question from Mario? Maybe Jessica Owen, Jessica B, sorry.
Hi, yes. I'm happy to answer the question. I'm not an expert on the social protection programs itself, and maybe why they won't be included. But I think one of the major reasons is that we're changing our focus now from undernutrition to thinking about more broadly what malnutrition is. So that's accepting that overweight and obesity and micronutrient deficiencies are just as important pillars into malnutrition as just undernutrition. So I don't think it was necessarily a conscious choice that overweight and micronutrient malnutrition has not been measured to date, but I think it's something that is now on the forefront. Governments are more aware of the dangers of overweight and obesity. More likely than not, it's still on adults, it's less on children. The focus on children is still very much on undernutrition. But I think as we work together to bring attention to the importance of when we're implementing a social protection program, that we need to have indicators which are measuring not only stunting and dietary intake, where we can look at undernutrition and look at micronutrient intake, but we need to be measuring consumption of unhealthy junk foods. I know anecdotally, there are cases in the region where cash transfers are used to purchase these cheap, highly processed convenience foods because they are available and they are easy to provide to your child, and they're cheap. So people will, instead of preparing a nutritious meal for the child, default to these convenience foods. So we have to look at, when we're doing a cash transfer, that we don't also increase prevalence of overweight and obesity and exacerbate micronutrient deficiencies. So in the new planning and the monitoring and evaluation of social protection programs, which are nutrition sensitive, I think it's really important, Mario, as you were saying, that we need to take into consideration not just undernutrition, but look at what are the impacts on overweight and obesity and on micronutrient deficiency. But also know our limitations, because there's a limited number of indicators, and certain things like micronutrient deficiencies may not be feasible just because it's quite expensive and cumbersome to collect. So certain indicators, nutrition status, dietary intake, would give us the indicators that we need to make better decisions.
Thank you, Jessica. Britta, do you have another question? And in the meantime, I'm putting together all the different questions I've seen in the chat box, and I will try to consolidate in a few broad ones. But thanks for keep popping up with your questions. Britta, over to you.
Yeah, sure. So another question I had was on the multi-sectoral collaboration. So we've heard that several times, that you recommend that that is recommended, or that it's a necessity, basically, for successful social protection programs. So my question is, how would a collaboration between sectors actually need to look like? Like if we take social protection, health, for example, we know that there are others, education and agriculture, but let's take these two. How does that need to look like in actual terms, this collaboration at national level, to make a social protection program, a nutrition sensitive social protection program, successful? If we could have an example, maybe, you know, that would be really useful to illustrate this, because the multi-sector collaboration, multi-actor collaboration, it's something we hear very often in many different contexts, but what is it that it is required, and are there any good practices out there concretely? Thanks.
Very good, and also a few participants asked the same question. So you are already summarizing many of the requests that we got. So who want to answer from the panelists?
I'm happy to start to answer, and I'm sure that Jessica Owens and Ruben would love to jump in. Or Jessica, do you want to start? No? Okay. I think, once again, it was mentioned several times during the presentation, but that it's important to look at the platforms, and that linking health systems with social protection platforms doesn't mean that social protection will be implementing the health interventions. It's that health is still implementing the interventions. We need to make sure that we break down the silos between the two. I think that the MCCT in Myanmar is a good example of how essential services are delivered through the health system and linked to the receipt of the social protection program. Jessica Owen knows much better about the MCCT, so I'll pass off to her.
Jessica? The other Jessica?
Hi. Yes, thank you. So yes, I think it's always easier to talk about multi-sectoral cooperation and coordination than actually implementing it. I think there needs to be both sort of, as we've seen for example, for India, where there was one side which was on the cash transfers and the message into the households, but on the other side trying to provide incentives and ensuring that there were sufficient number of front healthcare workers available to be able to support the increased demand. So it's trying to work on both sides to ensure that they can meet this excess demand. Looking at broader sides of how to collaborate also is looking at, we saw that with the importance, like as Nard mentioned, the importance of supporting livelihoods and agricultural or different types of livelihood programs, so to support the income of these most vulnerable who don't have other sources of income. And here too, looking at how do you bring the different sectors, such as the Ministry of Agriculture or the Ministry of Labor in line and bringing to the same. There is potentially referencing mechanisms, having a social worker or a person, a caseworker, who can be able to make these linkages between the different services available or interventions between the different government institutions, and bringing these to the same population is one of these things. These one windows that are also known, where you get all of the services that can be provided come to a certain office, and that this is the same place where the household is requested to go to receive the cash or to receive certain support, so that this is all of the information is collected in one place. So bringing in the different interventions coming together. It is not always easy. Looking at from the experience of FAO, looking at trying to bring in the Ministry of Agriculture and Ministry of Social Protection together, they need to come to the same population and adjust their programs to be able to meet the needs of these populations, and this is also something that needs to be taken into account.
Very, very good, Jessica. And also looking at the comments, it's difficult to implement as Jessica was, the other Jessica was mentioning, a fully integrated strategy when actually government don't work together. So the different areas, different ministries usually don't have an integrated approach. So we also be very careful on what we are pushing for, particularly with when we work with government. But Mario, do you have another final question on your side, and then we go through all the other questions that are coming out from the audience? Over to you.
Yeah, thanks, Andrea. So just very quickly, I found it very interesting that the study presented by NARD and the EAPRO team was much more optimistic in its conclusions than the working paper under the leadership of UNICEF and FAO, which looked at a review of the evidence. And I think also the conclusions on the 4 Ps that were in NARD's presentation are even more optimistic than the conclusions on the 4 Ps that are in the working paper. So I was wondering, is the reason that this is qualitative evidence in the EAPRO study versus more quantitative evidence on the other side? Or how can we make sense of the differences, and also what should we believe in the end?
Perfect. I think I heard my name, so let me jump in here. I think I agree. So the findings overall are positive, and they present reason to be optimistic, both in terms of the potential and about some of the impacts on the underlying and immediate causes. One important thing to note is that we do, however, not look into the ultimate indicator of interest, the child's nutritional status. And over here, all we can do is refer to the existing quantitative impact evaluation of the 4 Ps, which saw positive impacts in the first wave in terms of the child's anthropometric indicators, and a reversal of that in later waves, in the second and the third. Again, pointing to the mixed dynamics and the complexity of these results. However, at the same time, I do not think our results are so different. We see that same mixed evidence from the synthesis study across programs reflected at the micro level here in our study across households. And we see that for larger households and for households without complementary income, impacts really are less present. And that in more rural communities where payments are more irregular, impacts are also much less. Furthermore, I think where our studies most overlap is the realization that we need to go beyond cash and invest in complementary services. And I think to note here is that the 4 Ps is probably the largest program. It's the biggest program in the region where such complementary services in the form of the family development sessions are integrated directly into the program and its delivery channels. Many other nationwide government-led programs do not have this kind of complementarity as well, or only refer and link to other initiatives, perhaps explaining some of the differences too. And lastly, I think what should also be said is that currently there are still lots of design and implementation challenges, preventing the programs from delivering its true potential. Imagine if we would pay frequently and regularly. Imagine if the healthcare center would not be a boat ride away. Imagine if the benefit levels would actually be adequate enough for these impacts. Tackling these implementation inefficiencies has the potential to increase impacts of the cash as well. And thus, I remain very optimistic that social protection, if we tackle these challenges, remains at the center of also improving nutrition outcomes.
Very good. Thank you so much. And I tried to now to look at, and thanks again for all the questions. Some of them are very detailed and very specific. But I want to, we still have a few minutes, but I like a particular one question that comes from Eunice, and she asked, social protection is used as a platform for advancing food and nutrition responses. But what can food security and nutrition do for social protection? So it's revolting the other way around. What nutrition, food security can do for social protection? Who want to answer that one? And now the question is, of course, to all the panelists, including the two discussants, whoever want to take this question. Otherwise, I will finger point to some of you. Any volunteer?
Yes.
Yes,
let
sure.
me just step in very briefly. Sorry, I don't think that I'm the primary expert, so I'll hand over to the nutritionist later too. But what can they do? I think first of all, they can help us, because many of the social protection practitioners, they do not necessarily know how to evaluate nutrition and food security impacts. And I think we all agree that if we want to achieve these impacts, we need to actually start with measuring them. So just support in terms of advocating for the inclusion of these indicators in the objectives and the monitoring frameworks, that would be terribly great. But I think others are able to add as well.
Anybody else want to add? I can add one of the lessons that we learned, for example, was small things such as not only the amount of disbursement, it was mentioned, but the frequency. So what we discovered is that the frequency to help people to consume. So it has to be a small amount, more frequent, allows us to rethink the way we organize the payment. But Ruben, you want to add? Go ahead.
Yeah, just to complement what Nara was saying, is exactly that. So this is the forum where we have. I realized I've been working with Jessica, in nutrition sensitive preparation for already quite a while already, and we will keep working. So it has been a learning process, especially for me as a social protection practitioner. Long process. What are micronutrient deficiencies? What are they? Why is anemia so important for mothers? So these are specificities that food nutrition, food security, especially as a nutritionist, know we don't. So as the same process needs to go through government structures, and I think that's the main challenge when you are working in those. But we have a lot of multi-sectoral plans here and there, decentralized. So that's a starting point, and then you go to the technical part. And we have these forums, these learning sessions. So I think that's exactly the process. Over.
I can see somebody else popping up. There is another question, actually, is ways related, and it was about probably the interest from nutrition, and then the question was, how can we do the same for child protection, and probably how we can do the same for WASH and for other things. So this idea of XX sensitive social protection, so nutrition sensitive, child protection sensitive, health sensitive social protection, how we can put together all these things. Do we have the risk that we overburden the objective of social protection, or is an opportunity? Who want to answer? Anybody?
Okay, let me jump in there again. Yes, okay, I think it is a risk, right, on there. I think it is a primary risk. I think where we start is that we move towards a society where many of the complementary services are available and where many of the referral channels are standardized. So for instance, here in Thailand, sorry, I'm calling in from Thailand as well. Here in Thailand, we have the child support grant. And at the same time, we of course have issues regarding malnutrition. Does that mean we need to call for a nutrition sensitive version of the child support grant? Not necessarily. I think it all depends on the extent and the quality of the referral processes. As long as we identify children that are not growing well and are able to then refer them to the necessary growth monitoring channels, etc. So I don't think we necessarily want to add that's sensitive to anything. Let's look at what services are out there and how we can better integrate and link with them through standardized referral channels.
And that's very good. And I think also what Ruben was mentioning, this is a learning process. So social protection and people who are designing social protection intervention, as I said at the beginning, they start from the hypothesis that the cash allow people to set their priority. So we are not forcing people toward a specific objective. I understand if you're a nutritionist, you want to look at nutrition. If you're child protection, you want to look at violence. If you're a gender expert, you want to look at the situation of women, and etc. And it is important that we keep this cross-fertilization. So in the design, we take care of all these components. But always we have to remember that at the end, when we don't see a specific impact, is not because it's not there, but because also sometimes, most of the time, families and households have to take a decision over how they use the money and the resources they have. And we always have to respect. But what is important is that we know that. So I think that was a great the experience of fertilizing each other and to know more and more the topic. So as we've done with nutrition, we have to keep doing with all the different sectors. There are multiple questions about what we mentioned before about the principle of multi-sectoral approach. Everybody will agree, but then when you have to go into the implementation is very difficult. Is anybody able to provide an example of a good cross-sectoral approach where different ministries and different sectors were involved in social protection? Maybe Jessica Owen, do you have anything?
Yes, so it is difficult to find a good example of a cross-sectoral approach. For example, Nepal, there was an interesting, it was done at the local level where not only was it that the cash transfer was being looked at, they were also capacity building the capacity of the health services to respond, as well as the whole building the capacity of the local governments to be able to carry out this integrated approach. So there is this idea that you need to build the capacity also to be able to make these linkages at the local level. We also see from other examples from from Bangladesh, for example. Unfortunately, not unfortunately, but we do want to concentrate on national programs. But what we are seeing is that from pilots that are being looked at, that we can learn some lessons. So some of the lessons is this idea that bringing together these different types of interventions can help, and how to bring them together is what we're looking for in these types of interventions. In Bangladesh, what is very interesting is that they brought food security and agriculture interventions to the cash transfer, and saw that the synergies that were built with these types of maternal and health interventions plus the agriculture had these positive impacts on nutrition outcomes, and that they were more than their standalone part, so sort of reinforcing this idea. But it is also true that dialogue between the two, as FAOs, what we do a lot is trying to bring, for example, the Ministry of Agriculture and the Ministry of Social Welfare, and to create this dialogue for them to understand, to use, if they're thinking of targeting the different households or poor households, to use the existing mechanisms, registration mechanisms, to use these and to try to come together in that sense, or learning from the assessments or the that have been done on these households, to be able to design appropriate programs that could fit these households' needs and constraints.
Very good. Thank you, Jessica. Time for, and I keep saying, as I said, always the nice question arriving at the last moment. We are collecting all of them, and we try to provide a summary answer in writing to be posted later on the website. So that was fantastic. Before closing is ready, 4:33. I would like to give to each of the panelists like 15 seconds for their own comments or announcement or information, starting with Jessica B. Any last comment, last remark? Let's see if we can get, yes.
I'm unmuted. No, just to say it's been a pleasure to be able to work on the last SOFI and to work with social protection, because as the question referred to, it's what can nutrition bring to social protection? And it really is that you're having a healthier population, more stable and more able to combine, to contribute to the economic growth of society. So it's not just social protection giving to nutrition, but I think nutrition and health can add a lot to social protection. Thank you.
Very good. Thank you so much, Jessica. Ruben?
All right. So just a quick note. This is a learning process, and the long walk from the 2010 until today has been 10 years with, learning, improving. I think we will keep doing it. And one point on the quantitative versus qualitative, I think it's important to bring the qualitative aspect of it. Nutrition is about also quantitative and stuff, but it's so important to understand the nuances of how decisions are made within the household, inter-household decisions. And that's why, women's empowerment, which are underlying determinants, are so difficult to grasp, to understand. So we need the right research tools to understand the right underlying determinants that will bring somehow nutrition outcomes.
Very good, thank you, Ruben. Jessica, any last one?
Yes, just a last. It's more of a sort of a complementary tool that the UN agencies have been leading in the interagency social protection assessment initiative. So FAO has been leading the development with all of the organizations, including IPC, UNDP, WFP, Save the Children, etc. And the development of a tool to support, strengthen the food security and nutrition outcomes of social protection programs. So this tool will be coming soon, in the next few weeks, will be published on the ISPA.org site. That's all. Thank you very much.
Very good. Thank you so much, Jessica. Nad?
Yeah, very briefly, I just want to also acknowledge your colleagues in UNICEF Philippines for the leadership on this. They've really been excellent, Rosella, Ani, and yours. And the study is available on the government on the Philippines website. You can just Google it by putting in the name of the study, and then you'll find it. So, this has been really great. Thanks a lot.
Fantastic. Thank you so much, Nad. And Britta? And also, we want to thank WFP for that, for the presence. Yes.
Yeah, I hope that this paper will help us in making more investment in evidence for nutrition outcomes of social protections, and that we can jointly think about how we can encourage these investments in favor of the women and children and vulnerable populations. Thank you.
Thank you so much, Britta. And Mario, finally?
Yeah, I just wanted to draw your attention as well on a cooperation of the International Policy Center for Inclusive Growth and the FAO. We are working on a special publication on synergies between poverty and malnutrition reduction efforts. And there will be a couple of articles also on nutrition-sensitive social protection. This will come out in May or June, so stay tuned for that. You can, for example, get the IPC-IG newsletter on the IPC-IG.org website if you want to get an alert once that publication is out. And yeah, thanks to all of you for these great contributions and the interesting presentations.
Fantastic. Thank you so much, Mario. And well, first I want to thank you, all of you who are here with us for 1 hour and a half. Despite all the craziness of your work and agenda. I want to thank you, socialprotection.org, for hosting us. They are super professional, and we really enjoy a lot the support that we received was great. Also, the support from all the colleagues in UNICEF who helped, Teresa, Joab, and etc., who help us to put together this webinar. As I said, most of the material, actually all the material, the presentation, the recording will be available on the website, socialprotection.org. A summary will be produced in a few days, and also we'll try to address all the questions. Thanks again for the question that have been submitted. And we hope and we are sure that with your contribution, the paper will be better. Please stay safe. Thank you again. Goodbye.